Assalamu alaikum, class 10th. How are you all? I hope you will be fine and healthy, class. This is your biology lecture, and as you know, in last lecture we have discussed about the different glands and feedback back mechanisms. Today in our lecture we will discuss about the disorders of nervous system. We have discussed nervous system in detail, its part, receptor, effector. So this is our last lecture of this topic, last topic of this chapter, disorders of nervous system. So nervous disorders can be categorized into two major types: vascular disorders and functional disorders. Vascular disorders means there is a problem with muscles, with group of muscles. Functional disorders means there is a problem in the output of nerve impulse, its generation, its transmission, कि nerve impulse properly transmit नहीं हो रही, वो message को carry नहीं कर रही properly. अब normally जो है वो nerve impulse transmit हुई जा रही है continuously without any reason, without any signal. जबकि vascular disorders it may cause due to the disturbance in the blood supply to nervous system. नर्वस सिस्टम को जो ब्लड सप्लाई है वो प्रॉपरली नहीं हो रही, उसमें कोई डिस्टर्बेंस हो रही है. सो वन एग्जांपल ऑफ वैस्कुलर डिसऑर्डर दैट इज़ पैरालिसिस एंड one example of functional disorder that is epilepsy is discussed. We will discuss these disorders in detail. Paralytic patients have loss of function of muscle group. In paralysis there are certain causes that may cause it. Epilepsy also caused by certain factors. We will discuss the causes of both epilepsy and paralysis, and we will discuss about their treatments also. So let's discuss them one by one. First of all, paralysis. Paralysis is the complete loss of function by one or more muscle groups. As we have discussed that paralysis is the type of vascular disorder in which any disturbance in the blood supply to nervous system. So due to the disturbance in blood supply, muscle group may be disturbed. Due to this disturbance, paralysis is caused. Paralysis sometimes caused by damage to central nervous system such as spinal cord and brain. It may be due to some injury or some shock like that. The damaged nervous system may be due to stroke. Stroke means rupture in blood vessels of spinal cord or brain, blood clotting in the blood vessels of brain and spinal cord, or poison produced by some viruses such as poliovirus. Patients may have weak paralysis throughout his body or have paralysis inside of the body. There may also be paralysis in the lower extremities or in all four limbs. Sometimes paralysis affect the whole body, and sometimes it affect the certain parts of our body depending on the situation or depending on the part of brain or spinal cord affected. Sometimes paralysis is cured fully depending on the situation of patient. Epilepsy is a nervous disorder in which there is abnormal and excessive discharge of nerve impulse in brain. It causes unprovoked seizures in patient. A seizure of epilepsy is a temporary abnormal state of brain marked by convulsions. कि मतलब आपको पता नहीं चलता आप क्या कर रहे हो, दौरे जिसको कहते हैं हम, वो पढ़ना शुरू हो जाते हैं, convulsions आती हैं, patient may lose senses. In younger people, epilepsy may be due to genetic or developmental causes. Sometimes, mostly it is caused by genetic factors. People over age 40 years, brain tumors are more likely to cause epilepsy. Brain tumor भी epilepsy cause कर सकते हैं. Head trauma and central nervous system infections may cause epilepsy at any age. There is no known cure of epilepsy, but medicines can control seizures. So medicine are prescribed, mostly anti-epileptic or anti-convulsion medicine are given to the patients that control the seizure, but there is no cure of epilepsy. So that was all about the nervous disorders. I hope you have understand. For further query and question you can ask. Thank you.